Between 2005 and 2010, one service member died approximately every 36 hours, not as a result of combat, training exercises, or automobile accidents, but from suicide. In 2009, 160 active duty military personnel took their lives, making suicide the third leading cause of death among the Army population. Military suicide is considered to be the unseen enemy in war. In some cases, it can be attributed to a mental health condition such as depression, posttraumatic stress disorder, traumatic brain injury, alcoholism, or drug abuse. In military settings, a cultural stigma is often attached to seeking mental health care. According to the U.S. Department of Defense, 43% of soldiers, sailors, airmen, and Marines who took their lives in 2010 did not seek help from a military treatment facility in the month before their deaths. As more troops return from deployments, the risk of suicide may grow. It is important that families of these service members become aware of the issue and learn to identify potential risk factors and warning signs associated with suicide. As a caregiver, the more you know, the more you are likely to provide the immediate attention and care your service member needs. Several factors may influence a service member to attempt to commit suicide. These risk factors include work-related problems, a history of depression or other psychological issues, a family history of suicide or suicide attempts, a serious medical problem or physical illness, a recent disciplinary or legal action, significant loss such as death of a loved one or a fellow service member within a unit, drug or alcohol abuse, violence in the home or social environment, an unsuccessful relationship or relationship strain, excessive debt, and other financial problems. If you notice significant changes after your warrior returns home from war, he or she may be exhibiting the signs of potential suicide. These warning signs may indicate that your service member is suicidal. Changes in eating, sleeping habits, or personal hygiene, talking or hinting about hurting himself or herself, expressing a strong desire to kill someone, indicating that person would be better off dead, obsession with death, for example, in music, poetry, artwork, and letters, changes in mood and behavior, for example, depression, irritability, rage, or anger, increased alcohol and/or drug use or abuse, isolation and withdrawal from social situations, giving away possessions, updating a will or otherwise finalizing personal affairs, problems with a spouse or partner, the sudden or impulsive purchase of a firearm or another weapon. As a military caregiver, it can be hard to admit to yourself that your service member may be displaying signs of suicide. However, suicide has increased dramatically since the start of the global war on terrorism, leaving many service members at risk for thinking about or attempting suicide. In addition to identifying risk factors and warning signs, here are 14 strategies you can use to help your service member and yourself get through this difficult time. Look for any signs that show a change in behavior. Talk openly about suicide. Be willing to listen and allow your warrior to express his or her feelings. Ask your service member's doctors or nurse case manager for information regarding suicide and mental illness. Provide your service member with contacts for suicide prevention, for example, a chaplain or behavioral health professional. Remove any means that could be used for self-injury, for example, weapons or pills. If possible, accompany your warrior to his or her chain of command immediately. Do not ignore the situation and hope that it will eventually improve. Actively listen without passing judgment. Stay calm and safe. Do not use force. Provide a comforting and relaxing atmosphere. Understand that your loved one may be in pain. Be aware of how the service member's behavior may be affecting children in the household. Consider individual and family therapy. Do not keep your warrior's suicidal behavior a secret. Tell someone. If your service member is experiencing thoughts of suicide or exhibiting warning signs, take action immediately. Suicide intervention is not always an easy thing to do, but it may mean the difference in saving your warrior's life.